Today, I want to speak to you about something that affects millions of lives quietly, persistently, and often confusingly. The differences between two conditions that sound remarkably similar but are worlds apart in their impact. Irritable bowel syndrome, or IBS, and inflammatory bowel disease, also known as IBD. These acronyms, IBS and IBD, are so close that even healthcare providers sometimes catch themselves clarifying them. Patients hear one and fear the other. Families worry unnecessarily, or perhaps not enough. And in the midst of abdominal pain, urgent bathroom trips, bloating, and fatigue, it's easy to feel lost. But knowledge is power, and understanding the key differences can guide you toward the right diagnosis, the right treatment, and ultimately a better quality of life. So let's begin with the fundamentals. IBS, also known as Irritable Bowel Syndrome, is what we call a functional disorder of the gut. That means the digestive tract looks normal on tests, no visible damage, no inflammation, but it doesn't function as smoothly as it should. The muscles in your intestines may contract too strongly or too weakly, the nerves may be overly sensitive, and the brain-gut connection can amplify signals that, in other words, go unnoticed. Inflammatory bowel disease, also known as IBD, on the other hand, is a structural inflammatory condition. It includes two main diseases: Crohn's disease, which can affect any part of the digestive tract from mouth to anus, often in patches, and ulcerative colitis, which primarily inflames the lining of the large intestines and the rectum in a continuous pattern. Here, the immune system mistakenly attacks the gut, causing chronic inflammation, ulcers, and real tissue damage. Now, let's talk numbers to grasp the scope. IBS is remarkably common, affecting around 10 to 15% of adults worldwide, with some estimates placing it as high as 1 in 10 people in developed countries. In the United States alone, that's tens of millions living with symptoms. IBD, while less common, is also on the rise. Recent studies estimate that nearly 1 in 100 Americans, over 3 million people, live with IBD, and prevalence is increasing, particularly in newly industrialized regions. Both can disrupt daily life profoundly, but the risks and long-term consequences differ dramatically. With IBS, the primary burden is quality of life. Unpredictable symptoms that flare with stress, certain foods, hormonal changes, or even no clear trigger at all. There's no increased risk of colorectal cancer, no permanent damage to the intestines, and no life-threatening complications like bowel obstruction or perforation. That doesn't make it all in your head. It's actually far from it. The pain is real, the urgency is real, the fatigue is real, but the gut itself remains structurally intact. IBS is another story. Untreated or poorly managed inflammation can lead to serious complications. Strictures that narrow the bowel, fistulas, an abnormal connection between organs, abscesses, malnutrition from poor absorption, and yes, a significantly higher risk of colorectal cancer over time. Extra-intestinal issues can also arise, which include joint pains, skin rashes, eye inflammation, liver problems. In severe cases, surgery may be needed to remove damaged sections of the intestine. Symptoms overlap enough to cause confusion, though. Both can bring abdominal cramping, diarrhea, constipation, bloating, gas, and urgency. But there are red flags that point towards IBD, again, known as inflammatory bowel disease. Bloody stools or rectal bleeding, unexplained weight loss, persistent fevers, anemia from chronic blood loss, nighttime symptoms that wake you up from sleep, and pain that doesn't improve after a bowel movement. And they're frequently tied to meals or stress. No blood in the stool unless from something like hemorrhoids, and no systemic signs like fever or profound weight loss. Diagnosis reflects these differences. For IBS, there's no single definitive test. It's often a diagnosis of exclusion. Your doctor takes a thorough history, performs a physical exam, and may run blood tests, stool tests, and even a colonoscopy to rule out other conditions. The Rome criteria guide us. recurrent abdominal pain at least 1 day a week for the last 3 months, associated with changes in stool frequency or form, or relief from defecation. For IBD, diagnosis requires evidence of inflammation. Blood tests may show elevated inflammatory markers like CRP or calprotectin in stool. Imaging, such as CTs and MRIs, can reveal thickening or abnormalities, but the gold standard is a colonoscopy and or a upper endoscopy, where we would see ulcers, erythema, erosions, or cobblestoning characteristics of Crohn's, and biopsies of the tissue would confirm the inflammation. The treatment paths diverge here too regarding IBS and IBD. For IBS, we focus on symptom relief and triggers. Dietary changes are front line. Many benefit from low FODMAP diets, identifying and avoiding personal triggers like dairy, gluten, caffeine, or high-fat foods. Fiber supplements for constipation-predominant IBS, laxatives or antidiarrheals as needed. Stress management is crucial. Mindfulness, cognitive behavioral therapy, exercise, yoga. There are medications that target specific symptoms such as antispasmodics for cramps, certain antidepressants for pain modulation, and the gut-brain axis. Or newer agents like linaclotide for constipation or uloxadoline for diarrhea-predominant types. Inflammatory bowel disease treatment aims to heal inflammation and prevent complications. Anti-inflammatory drugs like mesalamine are first line for mild cases of ulcerative colitis. We use corticosteroids for flares. Immunomodulators or biologics in advanced therapies that target specific immune pathways, which is usually reserved for moderate to severe disease types. Biologics have revolutionized outcomes, allowing many to achieve remission. Antibiotics for infections or complications can also be used. Nutrition therapy and sometimes even surgery is necessary in some cases. Lifestyle also plays a role in both. Getting irregular exercise, adequate sleep, smoking cessation, especially critical in Crohn's where smoking worsens the disease. Why does this distinction matter so much? Because getting it wrong delays proper care. Someone with undiagnosed inflammatory bowel disease might suffer progressive damage while trying irritable bowel syndrome diets alone. Conversely, assuming inflammatory bowel disease when it's irritable bowel syndrome can lead to unnecessary worry, invasive tests, or medications with side effects. If you are experiencing persistent gut symptoms, pain, changes in bowel habits that last weeks or months, do not dismiss them. Do not self-diagnose from the internet alone. Seek a healthcare professional, ideally a gastroenterologist, and bring a symptom diary. A symptom diary usually consists of having information on when flares occur, what worsens or improves them, any family history of gut issues, and any medications you may have tried. Early, accurate diagnosis changes everything. To those living with irritable bowel syndrome, your struggle is valid. Management strategies can bring real relief, and support groups remind you that you're not alone. To those with inflammatory bowel disease, modern treatments offer hope like never before. Remission is achievable for many, and research advances rapidly. And to everyone, listen to your body. Advocate for yourself. Gut health affects overall well-being, mental health, energy, and immunity. Understanding inflammatory bowel disease versus irritable bowel syndrome empowers you to ask the right questions, seek the right care, and reclaim control over your health. My friends, thank you from the bottom of my gut for spending this time with me today and listening all the way through. If you found this information helpful, or if it brought you even a little clarity or relief, please show your support by hitting that like button and subscribing to the channel. It truly helps reach more people who need it. Turn on notifications too so you never miss new content on gut health, wellness, and better living. In this video's description, you'll find links to many trusted resources and a few carefully selected products that many have found beneficial on their journey. These are just suggestions. And one more important reminder. Everything shared here is for educational purposes only, and it is not a substitute for professional medical advice. If you're experiencing symptoms or have concerns about your health, please consult your doctor or a qualified healthcare professional. Take good care of yourselves, and I'll see you in the next video. Thank you again.